Do multiple, more PRP treatments for hair loss increase results? Hello, I am familiar with the series of injections approach when it comes to the first round of PRP injections for hair loss, but can additional treatments following this first series increase results? I understand this varies patient to patient. I have just heard of patients who weren't satisfied with the first round of injections go for fourth, fifth, and sixth injections to get desired results.
Thank you for your question. You're asking about the application of PRP for hair loss, and you're wondering, of course, what happens if a first round of sessions don't work, and that you're familiar with people going for a fourth, fifth, sixth treatment. So it certainly is a reasonable question if you are already understanding that a series of treatments is considered generally normal for PRP, specifically for hair loss. Well, I can certainly offer you a lot of insight into this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. The management of hair loss, hair transplant surgery has been a big part of my practice. I'm also the founder of Tricostem Hair Regeneration Centers, a method that we've developed of using platelet-rich plasma or PRP in combination with acellular matrix for the long-term management of people with thinning hairs. In other words, an alternative to hair transplant, and certainly with a lot of experience using PRP. So what I'm going to describe to you as my approach in no way is to disparage any colleague who is using PRP or platelet-rich plasma for hair loss. Just for clarification, platelet-rich plasma is basically a concentration of the wound healing factors in your blood that stimulate collagen, stimulate blood supply. So in our practice, and as a cosmetic surgeon, I use platelet-rich plasma very liberally in a lot of different places. I use it for under-eye dark circles. I use it for scar revision. I use it for acne scars. I use it for fine lines and wrinkles. We use a lot of platelet-rich plasma, and we always find a tremendous value and benefit in its application. From my observation in terms of hair loss treatment, platelet-rich plasma can, in some people, cause a short-term burst of growth. And based on that observation, my colleagues have, or many of my colleagues, have developed systems. So it is not unusual for a doctor to say, well, we have to see if platelet-rich plasma works for you, and you'll need an injection once every month. And we'll see how you do. Now, in our experience, patients who come to us who have had this type of treatment usually stop after 4 months. The reason is maybe they see a response, but after the 4th month, and very often there's not a consistency with the anaesthetic method, which means they're feeling a lot of their injections, they start to wonder how long are they going to have to keep doing this. In our practice, we use platelet-rich plasma. We've developed a system called Hair Regeneration, combining platelet-rich plasma with extracellular matrix. And what we've developed is a system and protocol. And essentially, with one injection treatment, we're able to sustain for years the benefit of stopping thinning process, reactivating hair that is no longer not growing, as well as having thinning hair shed and grow in thicker. Now, in select patients, we'll do a second injection, but that'll be usually after a year. And it's not typically necessary, but in additional research that I've done on my own patients and helping develop this, we've seen some value in strengthening the hairs that we're able to rejuvenate through this process. Basically, we've developed a non-surgical alternative for hair loss. And the main group of patients we treat are men and women with androgenetic alopecia, or male or female pattern hair loss, which is the most common cause of hair loss, accounting for more than 95%. So you can understand that from my perspective, platelet-rich plasma alone is not as effective as our treatment. So I would suggest that you have this discussion with the doctor that you're considering going to as far as what is a realistic expectation out of platelet-rich plasma. Some of my colleagues swear by it in terms of hair loss, and it is not up to me to say whether or not they're right or wrong. I can only tell you from my experience and my extensive use of platelet-rich plasma and wound healing material. I think that what we've developed, Hair Regeneration, and the company that we have developed to try to bring this treatment closer to people, we have patients who come to us from all over the world, and they come in for one injection. We've had patients come from China, from India, and who specifically come for this one treatment. So you can imagine that this treatment had better work. So I think that you have an opportunity here to learn more about these other options. Platelet-rich plasma has been a very, very successful modality for us in our practice for many applications, as I mentioned before. But for hair loss, hair regeneration has been what we have found to be an ideal way to use the benefit of platelet-rich plasma with the other materials that we've developed in our protocol. So I hope that was helpful. I wish you the best of luck, and thank you for your question.